Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Catecholomethyltransferase inhibitors. The drugs which are catecholomethyltransferase inhibitors are we have tolcapone and entacapone. Okay, these tolcapone and entacapone, both these will actually inhibit the dopamine degradation because this catecholomethyltransferase is the enzyme which is involved in dopamine degradation. So as a result, both these will inhibit dopamine degradation. Tolcapone has central action mainly, whereas entacapone has both central and it also has peripheral action also. And tolcapone is more potent, whereas entacapone has less potent. Okay, then we can use drug combination therapy. We can use levodopa with carbidopa. Levodopa and carbidopa combination can be combined with entacapone, and it is used for advanced Parkinson's disease. We can use this combination of levodopa, carbidopa with entacapone. So the side effect of and sorry the and tolcapone first. The side effect of tolcapone is tolcapone can cause hepatotoxic effect, or it can also cause rhabdomyolysis, whereas side effect of entacapone is entacapone can result in, so actually this entacapone will accumulate in the renal failure. So this is one side effect of entacapone. So tolcapone and entacapone are mainly used in severe or advanced disease of Parkinson's disease. Okay, tolcapone, it is more potent and this causes hepatotoxic, so it is not used because of this hepatotoxic nature. So it is not used normally due to hepatotoxicity. And one more thing, this talcopone is also used in conditions of, it is also used in on and off phenomenon which is caused by levodopa. In order to avoid this on and off phenomenon caused by levodopa, we can use this talcopone.
thank you and thank you for watching.